I'm going to go ahead and begin, and we will definitely have some time for Q&A and some crosstalk during this session before our 1 o'clock community partner panel. So welcome to the annual meeting of the Cancer Prevention and Control Research Network. We are so delighted that you all are here. I'm Stephanie Wheeler. I'm the PI of the Coordinating Center here at the University of North Carolina at Chapel Hill. And we are going to be doing a very brief update on network progress. And I will also share a couple of things we wanted people to be aware of. And then we're going to go straight into a subset of our work group presentations. So welcome back. And this is my gist that I'm so excited about. The last year has been bonkers. And the last month in particular with the Omicron variant has wrought a whole host of new challenges. And so I just want to acknowledge that and to say that we are so grateful that you're here today and that you're spending your time with us. We know that you have a lot of competing demands. We know that COVID has disrupted so much about our work lives as well as our personal lives. And your time is incredibly valuable. So thank you for being here. We welcome your input over the course of the day. We hope to have a lot of cross discussion as we move through the day. And I just want to say hooray and congratulations for making it through yet another year of this pandemic. So just to orient everybody to what we're going to be doing in the annual meeting today, some of you attended our orientation to the network, which started at 11 a.m. Eastern. For those of you who might have missed that, it was recorded, and so that is available. If you want to learn more about the functions of the network and you still need to get up to speed on some of that, feel free to take a look at that. I do want to ask everybody if you would please mute your lines. That would be helpful. We're getting just a little bit of feedback. That would be great. So in terms of what we're going to do today, we have, as I said, a little bit of progress that I will share. This is reflecting on the progress reporting that all of the network centers and collaborative work groups did in December. And there's just so much. It's a tremendous amount of accomplishment. So this is just a little snapshot of what will eventually go into our broader report of the progress from the past year. As I said, we'll have 3 work group presentations, and then in about 40 minutes from now, we're going to do a group photo. So we did this last year via Zoom. We would love to see you if you have an accessory, a wig, a hat, a scarf, whatever that you want to put on. We'll do a funny photo as well as a professional photo of the whole group, and then Alexa will string those together for an entire network photo. We also welcome filters. I think last year we had Bernie Sanders as well as maybe the cat lawyer in people's backgrounds. And so those are great too. Feel free to bring those for the funny photo. And then we're really excited about our community partner panel that will come at 1 o'clock, followed by a break, and then Dr. Richardson from the CDC at 2:30. Later this afternoon, we're going to do some strategic planning pre-work in advance of some strategic planning that we'll be doing later this year for the entire network. And then we'll wrap up with a few interest group presentations, remarks from NCI, and then our co-chairs, as well as our CDC partners, will close out the meeting this afternoon. And we will be done by 5 o'clock. As I said, we'd love for folks to stay muted unless you're talking. It's up to you if you want to have your camera off or on. And it's perfectly fine if your dogs, your cats, your pets, whoever shows up in view. We appreciate that life is happening all around us. And we do want people to view this meeting as interactive. So at this point, we'd love for you to use the chat just to tell us your name and your affiliation and something that you're looking forward to in 2022. And then we encourage everybody to tweet about interesting things that you hear throughout the day using our handle at CPCRN Cancer and or the hashtag CPCRN 2022. So I think most people are probably familiar with our network vision and mission, so I won't belabor these, but I do want to note that a key hallmark of this network has always been focusing on implementation of evidence-based cancer prevention and control strategies. And we do that with a particular focus on medically underserved populations. And you'll hear more in today's session about the extent to which our work is focused on those populations and the extent to which our work is focusing on enhancing cancer health equity. We also have a strong and increasingly growing effort to really contribute to building the workforce in cancer prevention and control science, as well as implementation science. And so I'll share a couple of highlights from our scholars work group to really familiarize everybody with that effort. Don't forget to tell us who you are and what institution you represent in the chat, please. Thank you. And here's our network map. You can see the 8 funded collaborating centers from the CDC in the dark blue. So this should be familiar to many of you. You can also see in this map where our affiliate members are located. We're up to 34 formal affiliate members. You can also see our federal agency partners at both the CDC and the NCI represented on this map. And maybe most excitingly, our scholars, our current round of 17 funded scholars or supported scholars are listed here, and we are officially international with the scholars program with someone from Switzerland now participating. So we're growing and we're excited about this growth. Next up, we have just a recap of what the current collaborative cross-center activities are. I just wanted to show this because I'm not going to spend a lot of time talking about it, but as a refresher, these are the activities that we're currently invested in terms of our work groups and our interest group organization. So the dark blue represents those work groups that have established charters and established deliverables that they're working towards. All of these groups participate in our progress reporting. And again, I'm going to do a spotlight on the CPCRN Scholars Group in just a minute. And then the lighter blue reflects the affinity groups or the interest groups where people are just starting to organize around common themes. And sometimes these also result in collaborative publications or eventually advance and grow into a work group. And then we have 2 here at the bottom that are holdovers from our last cycle and are still producing work in these topic areas that started in the previous cycle. So this is the slide that everybody gets excited about every year, and I am just really delighted to see the level of productivity that you all were able to realize in what was clearly a difficult year given the pandemic. Based on our progress reporting, we have been able to document that there's $45 million in grants that were awarded to members of this network in the past year alone. That's a tremendous level of grant success and grant activity. So congratulations to all of you who wrote and were awarded these grants. We also saw 155 publications network-wide in the past year, almost 100 presentations to various groups, and 23 trainings that were delivered. And we'll talk a little bit more about some of those trainings in the scholar session. But this is just a wonderful contribution to the greater cancer prevention and control field, and an unbelievable amount of productivity, which is just really exciting to us and very inspiring. You can also see the amount of grants, publications, presentations, and trainings that have been done during the course of this current cycle. We're only 2 years in, and since the network's inception, and since we started tracking these activities in 2004. I promised a spotlight on the Scholars Program, and here it is. The Scholars Program is co-led by Dr. Friedman and Dr. Scoffrey at USC and at Emory, and the project directors who support this work and are really the magic behind this work in many ways are Sam Noblet and Courtney Pitania at Emory and at USC. This program was initiated in 2021. And it's focused on really bringing a whole cadre of early career scientists into our network, exposing them to training in dissemination implementation science with a focus on CPC and obviously health equity. To date, we've had 37 scholars in the program, 20 graduated this past year, and 100% of the scholars who graduated plan to remain engaged in the network. So hi to those of you who are alumni. And welcome to those of you who are new scholars in this program. We're really excited about the work that the scholars have been able to do, the extent of the collaborations that have formed, and again, to the leadership of this work group and what they've been able to accomplish. I also want to note just 2 aspects of the progress report that were new in the past year. And where we have seen a lot of network activity and you know, things that have come things that have come through the collaborative nature of this network, as well as some of the center-specific activities that are just, exciting, and really wanted to highlight those. So we started asking in our progress reporting this past year about COVID-related research activities, outreach, and dissemination efforts. And as you'll see here, our network members did a lot in this past year that was COVID-related as it connected to cancer. There were 70 new research initiatives that were underway. You can see a couple of examples here from the University of Iowa and our NYU CUNY investigators, looking at things like how COVID and social distancing affected cancer-related risk behaviors and survivorship, as well as looking at issues of mental health and how it affected people differently according to their socioeconomic status in the context of the pandemic. I also want to note the grants that were received, $11 million in funding to support new cancer and COVID-related research initiatives. So a quick highlight and a thumbs up to the Colorado site, where they're focused on service gaps that were introduced as a result of COVID, and our colleagues at Emory looking at the scalability of the Survivor Link program. So this is a virtual personal health record program that is now collecting information about COVID-related attitudes, beliefs, and behaviors. So again, this was just a subset of the wonderful things happening, but it's wonderful that our network members are so responsive to the reality that we're all living in and finding ways to adapt their science to be cognizant of these challenges, as well as the opportunities that COVID presents. And then secondly, we introduced a measure in the progress reporting system to invite our centers to comment on their health equity activities. And this was something that was championed by our equity interest group, which is led by Chow and Prajakta. And I think that we were really excited to see, and maybe not surprised, but definitely excited to see that 100% of our centers were reporting initiatives focused on health equity first and foremost. So just a couple of those highlights. The UNC Collaborating Center had 5 core projects, all of which were focused on health equity, including a pharmacy-based fit distribution project that is highlighting access to colorectal cancer screening in rural areas. Our Washington partners were looking at strategies to optimize colorectal cancer screening in Spanish-speaking patients and those with limited English proficiency. Another team at USC was doing some work focused on rural leukemia patients and treatment adherence. And then as we look at the grants that were health equity focused, there are 23 funded awards just in this past year, totaling $23 million of grant support that has been leveraged through this network and the wonderful work of investigators in this network to support this. Arizona is one of the sites looking at dietary patterns and non-alcoholic fatty liver disease among Hispanic populations. And then our NYU CUNY partners collaborated on the RADx program to look at COVID inequities and testing delivery. So I want to just remind folks of a couple of resources as we wrap up this progress update. We have, again, just a wonderful directory that Rebecca Williams and Alexa Young have been putting together over time. In the orientation session, Rebecca spent some time really familiarizing people with the directory and the website at large, and so I'd encourage you to take a look at that orientation session if you want more information. But you can always find those folks who are participating in this meeting and the folks who are active in the network on this directory. As well, we have a lot of really great detailed information about people's areas of expertise that you can engage with visually through our Kumu platform and the great work that Rebecca's done to build these interactive Kumu dashboards that focus on people's areas of expertise as it relates to cancer content, as it relates to methodological expertise, and then finally, the types of community partnerships that our center investigators are engaged in. So with that, I am going to transition over to our work group presentations, but I do want to make sure you know how to get in touch with me and with Becky Lee, our center project director. And a reminder to check us out on the web, follow us on Twitter and Facebook. And also we have a YouTube channel now. So take a look at some of the resources available there as well. Let me just pause and see if there's any questions before we bring up slides for the work group. Hi, everybody. I can see you now. Any questions that people want to come off mute and raise? All right. Well, then I think we're ready to transition to work group presentations.